Hi, everyone, and thank you so much for attending Johnny Carl Barba's talk. This is the last medical student Grand Rounds talk for this academic school year, so we're so excited that you were able to tune in, and we have an awesome talk lined up for you. I'm obviously not Johnny. I'm a student council member who's one of the organizers. So I just wanted to quickly orient people to MSGR if this is your first time attending. MSGR was created in fall of 2020 to acknowledge the achievements of medical students such as Johnny and their passions. And they consist of medical student presenters introduced by faculty or community mentors who have been influential to their success. This month was a bit different, but we normally have MSGR on the first and third Tuesday of each month. We use Zoom this entire year and we'll reevaluate in the fall to see if that's something we will continue with. Like I said, this is our last talk and we're so excited that Johnny was able to cap off our season, and we will tend to resume our MSGR talks in August. So if you are inspired by Johnny's talk today and you know another medical student who is also accomplished and passionate and would be a good fit for MSGR, please nominate a speaker for the upcoming year. And if you would like to view Johnny's talk or any other MSGR speaker's talk after today, we upload all of our talks with the permission of our speakers to YouTube. So you can check it out in a few days if you want to watch it again. So without further ado, I will turn it over to Tracy Mann, the Chartered Advisor in Philanthropy, Director of Gift Planning at the Foundation for Appalachia in Ohio, to introduce Johnny.
Hello, everyone. I'm so excited to be here. As Allison shared, I am with the Foundation for Appalachian Ohio, a community foundation serving the 32 counties of Appalachian Ohio, where our vision is for the citizens of Appalachian Ohio to live in a region abundant with possibilities. We actively work to build philanthropic resources within our region. Our value goes beyond financial management. We are the region's catalyst and tool for uniting gifts of time, talent, and treasure to create transformational impact. It's an honor to join this MSGR. You, the students, faculty, graduates, and all members of the medical team that I've encountered at The Ohio State University set the quality of effort bar high for all of us. Your extraordinary commitment and sacrifice are commendable and appreciated. While I'm grateful for every medical service I've ever received, and I would never diminish that, the services and care my family has received through The Ohio State University has been at a whole different level. So it's wonderful to have the opportunity to say thank you to all of you and for all that you are doing. I'm also grateful to be the presenter today and to introduce your speaker. He's been an inspiration to me and our foundation since day one. I'm delighted to introduce John C. Barba II, graduate of Meadowbrook High School in 2014, graduate of Muskingum University in 2018 with a major in neuroscience, soon to be graduate of The Ohio State with a master's in public health, and a current medical student at The Ohio State University. His journey with the Foundation for Appalachian Ohio, and I'm going to say FAO moving forward, and therefore with me, began in 2014 when he was awarded one of FAO's scholarships. Since that time, John has received multiple scholarships from various scholarship funds at FAO. He's been a great partner to us, a champion to our foundation in so many ways. He participates in our events. He helps communicates the need for scholarships. He really brings scholarships to life for us and shares his hope to one day practice medicine in our region. His studies have included Appalachian Ohio, for which we are truly thankful. As I shared, FAO's vision is to be a region abundant with possibilities. And we could not do that alone. We cannot achieve that by ourselves. It's together with donors, partners, friends, champions, and students that we will achieve that vision. And currently, Appalachian Ohio has significant challenges, and I'm sure Johnny is going to be talking about that, which impact many quality of life areas including health. And our region's people and their possibilities benefit from students like Johnny Barba, who focus on Appalachian Ohio health in their studies, addressing challenges, developing ideas to overcome some of them so that needed preventive and wellness services can be provided. It's my pleasure to welcome Johnny Barba.
Thank you, Tracy, for that very heartwarming introduction. It means everything to me. And as you'll see, as I talk about Appalachia, it's really I'm a product of a village of support. And through the foundation support, I've been blessed to be able to achieve and pursue my dreams of pursuing a master's of public health and a medical degree. So thank you, Tracy, for that introduction. And so again, my name is John Carl Barba II, and I'm a medical student, a master's of public health student here at The Ohio State University. And I'm very blessed and honored today to talk to you about overcoming Appalachia's mountains of health disparities, one small stone at a time. And to me, Appalachia can be best categorized and characterized by its 3 Ps. So I purposely misspell Appalachia. Instead of with 2 Ps, I misspell it with 3 Ps because to me, it's characterized by its place, poverty, and people. And so with that, let's go ahead and get started. So introducing you or reintroducing you to the Appalachian region. The Appalachian region spans 13 states, all the way from New York to northern Mississippi, as you can see here in the colored sections of this map. And for me, I am from right here. That little county right there is called Guernsey County. So I was born and raised in Byesville and Cambridge, Ohio, in Guernsey County, and I'm very honored and blessed to be a child of Appalachia. And that's why I am dedicating my master's of public health career and my medical career to serving the folks in Appalachia, my friends and family. And as we go through this talk, I will share numerous statistics about the health challenges of the region, the poverty of the region. And when I see those numbers, I really don't see numbers. I see the people, I see my family, I see my friends who make up those statistics. And that's why I am so passionate to give this talk to you today. And so talking a little bit more about the Appalachian region, it is geopolitically defined. And what do I mean by that? So geo means geography. So it's characterized by its rural mountainous terrain. So that's the geography part of that. And politically, it was defined based on certain characteristics of all the counties in Appalachia. Moreover, Appalachia is disproportionately rural. It contains 22% more rural lands than the nation. Moreover, Appalachia is home to 8.2% of the US population, which is 26 million Americans. So Appalachia is home to many Americans. And so talking a little bit more about health disparities, Appalachia is also home to numerous health disparities. And it would take a lecture in and of itself to talk about all the health disparities of Appalachia, unfortunately. So let me give you just kind of a high level view of them. And so this map here, as you can see on the screen, is cancer mortality rates in Appalachian states relative to urban non-Appalachian states. And as you can see here, the map's just popping off the screen at you, and it's just screaming the health disparities of the region. As you can see here, Kentucky has a 36% higher rate. Here we are in Ohio with a 15.5% higher rate, and West Virginia with a 19.2% higher rate. So you can see all these rates popping off the screen. And so that was just the cancer mortality rates. Appalachia also has higher mortality rates than the nation for 7 of America's leading causes of death. These include things such as cancer, suicide, diabetes, stroke, cardiovascular disease, injuries leading to death, and chronic obstructive pulmonary disease. And so Appalachia is home to numerous health disparities. And so how do these health disparities arise? To me, these health disparities arise due to the intersectionality of the 3 Ps of Appalachia: place, poverty, and people. And so let me give you an introduction to those 3 Ps. So in terms of place, Appalachia is characterized by its lack of healthcare services. It's hard to navigate rural mountainous terrain, longer transportation times to healthcare services, especially for rural populations, a lack of public health infrastructure, and more Medicaid enrollees. And what do I mean by that lack of public health infrastructure? Well, look at this picture here on the screen. And honestly, I found this online and I thought it was a picture of Derwent, which is a little town just near me. I still think it actually might be. So, but if you just drag your eyes along the road here, what's missing? There's no sidewalks. And this is very common in Appalachia, especially in the rural areas. And so as healthcare professionals, when you say, you need to get out and take some walks, you tell patients to take the walks, where are they going to take the walks? Especially if they're older people who might have fall risk, where are they going to walk? I mean, look how mountainous this is, look how hilly this is, and there's no sidewalks to walk on. And actually, I've seen people trying to take walks on the sidewalk, and I saw somebody get hit in the head with a rearview mirror off the side of a truck. And so these roads are windy and twisty and came around a blind turn just like this. And yeah, so that is just one thing that what I mean by the lack of public health infrastructure. And we'll talk more about that later. In terms of poverty, the poverty of Appalachia is characterized by financial disadvantages that restrict residents from accessing care, social mobility, and contribute to negative providers' stereotypes about patients in Appalachia. And so if you look at this diagram here on the screen, Appalachia is in yellow and the entire United States is in blue. And this starts from 1960 and goes all the way to 2019. And if you look across the screen, you can see that the yellow Appalachian bars are persistently higher than the United States. This indicates that the poverty of the region is persistent and still present to this very day and to the talk I'm giving to you now. And if we look at this slide is even more disheartening in some ways. Again, Appalachia is in yellow, the United States in blue, from 1969 all the way up to 2019. And this is about personal income inequalities between Appalachians and the rest of the United States. And as you can see, there's a persistent gap between these two lines. And what's even more disheartening is as you get up towards 2019, this gap does not appear to be narrowing. In fact, it looks to me as if it's getting larger. And so this restricts social mobility in the region and ability of folks to advance. So these are really important things to keep in mind. And so for our last P, let's talk about people. People is really captured by culture. Appalachia has a very unique culture that is characterized by collectivism with the sharing of information and resources within close-knit networks that protect their own and can be distrustful of outsiders. Moreover, research studies have shown that Appalachians are less satisfied with the quality, information, courtesy, and convenience of their healthcare. And so this was an overview of the 3 Ps of Appalachia. And now I want to go into a bit more depth about each of them, starting with poverty. So pictured on the screen here is a map of the Appalachian region. And you can see here's the poverty rates and the percentages each of the colors represent. And so from 2013 to 2017, the average poverty rate in the Appalachian region was 16.3%, and this ranged up to 41%. In comparison to non-Appalachian counties, the poverty rate in those counties was an average of 14.6%. And why these just seem a couple percentage points off, again, this poverty rate has been persistently, there's been a persistent gap, I should say, between these poverty rates. And when you're talking about 26 million Americans, percentage points mean a lot of Americans and a lot of people in the Appalachian region. And so that is why I say persistent poverty permeates all aspects of the region. Delving into this a little bit more, this is a really interesting chart. So in blue is the rural regions in Appalachia, and in black are the non-Appalachian rural regions in America. And as you may know, rural regions in America tend to be poorer than urban regions in America. So I thought it'd be interesting to do some research and see, how does Appalachian's rural regions that are poor stack up to the larger United States rural regions that are considered more poor? Well, looking at this chart and looking at this data here at the bottom from 2016, you can see that the average poverty rate in urban America was 12%. In rural America, that was 16%. And in rural Appalachian regions, again, that poverty rate is higher at 22%. So even when compared to the poorest regions in America, Appalachia is the poorest. And that is why a key message is that persistent poverty permeates all aspects of the region. Moreover, this poverty really restricts social mobility and the seeking of advanced degree attainment. And so I'll tell you a little bit more about that in a second, but looking at this chart here, Appalachia is again in yellow, the United States are in blue. And if you drag your eyes across here, you can see that the Appalachian percentages are lower than the United States percentages. And these percentages specifically represent the achievement of advanced degrees. That is a bachelor's degree and beyond. And you can see that the educational attainment is persistently lower in the Appalachian region compared to the larger United States. All of this represents poverty and restriction of social mobility. As a medical student and master's public health student, I find myself incredibly blessed and honored to be able to pursue advanced degrees. I grew up, my dad passed away 2 weeks before I was born. And so I was raised in a single parent home with my mom. And I was really raised by a village of support with friends and family that more close to family than anything. And it made my dreams possible. But that is not true for many Appalachians and many people, even from my high school and people I know. When you get out of school in high school and your family's been suffering from poverty, they need you to go get a job. That's just point blank what it is. A lot of people, it doesn't even enter their minds that they can go and, pursue education. A lot of people say, oh, oh, you go to college, you explore your interests, go see who you're going to be in college. That's not a reality for some people. When your family comes from poverty and things of that nature, it's like, you got to get a job. You got to start making money. You got to start contributing and helping the family out in that way. There's no time to explore your interest and go to college. That's just more money down the drain when you could be making money. And that is just such a salient point. And that's why I find myself incredibly blessed and honored to be in the position I am today, and a dream that I really want to make sure that I pass on to the next generation, that there are opportunities with the Foundation for Appalachian Ohio, and there are numerous people out in the world who really want to help and see you advance your studies and degrees. So that is why this chart is put here. It just really hit me and made me reflect upon my own journey at this point. And so after talking about poverty, let's talk. Oh, I got one more slide on poverty. After talking about those kinds of poverties, I want to talk about childhood poverty rates as well. And so this chart here represents childhood poverty rates in the state of Ohio at the top, the Appalachian region as a whole in the middle, and rural non-Appalachian regions here. And one thing I should note, if you look at the race and ethnicity part of this, the Appalachian region as a whole, and this is true for children and adults, is predominantly composed of people identifying as white and Caucasian. The region is known to be less racially and ethnically diverse than other regions. But these trends are starting to change. But that is just something that's important to know about Appalachia. Moreover, if we look over here at the economic well-being of children in poverty, here's the rate in Ohio, here's the rate in Appalachia, and here's rural non-Appalachia. And as you can see, a significantly higher proportion of children in Appalachia are living in poverty. Moreover, as you can see, more children are enrolled in Medicaid and enrolled in food supplemental nutritional assistance programs, or SNAP benefits. And I will be transparent with you. I was blessed that I was able to be in these programs growing up. In fact, I was in this childhood poverty rate. And why I say I'm blessed to be in the Medicaid and the SNAP is because those things really do help. They helped get me insurance and helped support our family through my journey. And really, those things are so important for supporting folks. But it's important to know that children really do grow up in poverty in this region, and that is especially concerning. And it is concerning because living in poverty really relates to this diagram here, which is the adverse childhood experiences. And as you may be familiar with this, poverty is one of the indicators that increases someone's risk for mental health disorders, cancer, diabetes, alcohol, drug abuse across the lifespan. And so what I always say is that early beginnings leave lasting impacts. And that is why it is so critical and important to focus on improving the childhood poverty rate and the overall poverty rate in the Appalachian region. And so with that, let's now talk about Appalachia's place and how that intersects with poverty. And so Appalachia is not home to many providers. It's home to numerous health disparities, but it's not home to many providers. Specifically, in terms of Appalachia versus the nation, Appalachia has 12% less primary care providers, 26% less dentists, 28% less specialists, and 35% less mental health providers. When talking about the Ohio region and the 32 Appalachian counties in the Ohio region versus the nation, Ohio Appalachian counties have 30% less primary care providers, 65% less specialists, and on average, they have 57 primary care providers per 100,000 people versus non-Appalachian counties in Ohio having 81 primary care providers per 100,000. So Appalachia is not home to many providers, something I hope to change. And I might not bring these percentages down, but I plan to come back home and practice here. And so I hope to help mitigate those in some way. So Appalachia also lacks public health infrastructure. And again, here's that picture we saw on the first slide talking about how the Appalachian region lacks sidewalks. What else the Appalachian region lacks is public transportation options. This is a picture of a bus stop here in a kind of a rural area with animals behind it. And I included this to really emphasize that there is a lack of public health transportation options. There is a lack of bus stops and things of that nature. In fact, there's 5 times less public health transportation options or public transportation options in the Appalachian region. And so when folks are trying to get to care, it's like, okay, care is already significantly farther away. I think on average, Appalachians have to spend almost 1 to 2 hours greater driving time to get to the nearest center of care, depending on where they are. And so without public transportation options, this is hard to get there. So why don't people just drive? Well, look at this car up here in this image up here with the road. And now look at this truck. Appalachians own 3% less vehicles, and the vehicles they own have been found to be in poor condition and making them less operable and usable. And that relates to the poverty of the region. So not only are Appalachians further away from care, but they lack public transportation options to get them to care, and their personal transportation options may not be capable of getting them to care, further reducing the accessing of care in the Appalachian region. Moreover, Appalachian region, and I put this picture of the YMCA here to emphasize that the Appalachian region lacks healthcare facilities and centers such as the YMCA. There's significantly less of them in the Appalachian region. Again, another thing further reducing healthy living in the region. And so that is what I mean by a lack of public health infrastructure. Moving forward, talking about place and poverty intersecting again, being insured with Medicaid in the Appalachian region does not equate to healthcare access. And so let me talk a little bit about Medicaid. And so Medicaid, as you may know, is a Social Security insurance program that is designed to help low-income families and persons get health insurance. And specifically in rural Ohio Appalachian counties, these have the highest percentage of Medicaid enrollees. And not only do these counties have the highest percentage of Medicaid enrollees in the state of Ohio, they are also tied for the largest population eligible, but not enrolled in Medicaid in Ohio. And so that is really concerning because not only do they have the highest percentage of people enrolled in Medicaid, they have the highest percentage of people eligible, but not enrolled in Medicaid. And I really think that not enrolled relates to the stigma people experience by being enrolled in Medicaid, especially in the Appalachian region. And we're going to talk more about that. And so why does Medicaid insurance not equate to healthcare access? Well, in fact, having Medicaid insurance may paradoxically restrict access to care. Specifically, as we noted on the other side, the Appalachian region already lacks dentists, right, and other healthcare providers. Well, this is further compounded by the fact that only 30% of dentists in the Appalachian region accept Medicaid as a form of insurance. Not only this, but Ohio ranks 20th in the nation for physicians accepting new Medicaid patients. And so this relates to the fixed paid structure of Medicaid, where Medicaid only pays a fixed amount of fees to providers. And so transparently, I have been on Medicaid my entire life. I still am to this day. Again, I was raised in a single parent home after the death of my father 2 weeks before I was born. And it's hard to get care and know how to navigate the system when having Medicaid, because you may call an office and ask, hey, do you accept Medicaid? And they may say yes, but they only accept so many patients on Medicaid because of that fixed payment structure plan. So even though an office or a dentist's office or a physician's office may say, hey, we accept Medicaid, they may only accept so many due to that. Moreover, I've even heard about physicians going bankrupt if they accept too many Medicaid patients. So the system's really not set up for Medicaid patients to get care. It looks good to have healthcare insurance, but it can paradoxically actually restrict access to care, because even in the Appalachian region, if there's only a few providers available and those few providers only accept a fixed number of Medicaid patients, that further reduces the accessing of care in the Appalachian region. And this relates so strongly to this next statement, and that is Ohio Appalachians enrolled in Medicaid report 43% greater utilization of emergency room services. Who cannot discriminate against people coming in with Medicaid? Emergency room services. And so this number here, based on my experiences and experiences of others I know, of using greater utilization of the emergency room services is not surprising in the slightest to me. Moreover, Appalachians report that on average, 25% of them state that urgent care serves as their main healthcare location. Again, less discrimination for your insurance. You can just go right into the urgent care and be seen. And so all of this really relates to Medicaid and how it may paradoxically restrict access to care in the region. Moreover, Medicaid is highly stigmatized. There are numerous reports in the literature about patients on Medicaid experiencing stigma and shaming from providers for being on Medicaid and things of that nature. While I've had great healthcare and while being on Medicaid, I've certainly realized that some of these things are especially true in terms of stigma. And the literature is rich in talking about stigma related to being on Medicaid in the Appalachian region. And so I think this is a good time to talk about one of the intersectionalities of the entire 3 Ps. So that again is poverty, place, and people. So poverty in the region necessitates that people are on Medicaid insurance, and place, this intersects with, again, physicians and providers accepting less Medicaid patients and being less available, as well as provider stereotypes about patients being on Medicaid and the stigma associated with that. And these poor healthcare experiences or stigma and shaming that people face are shared in close-knit networks within Appalachian cultures. And so if people are experiencing these stigmas, that may further reduce the seeking of care, as these are shared within close-knit networks. And if there's only a few providers in a region and they feel stigmatized based on them, that will further reduce care, because it's not like they can just go to someone else. There's already already a fixed and limited number of providers in the region. And so that is what I all mean by being insured in the Appalachian region does not equate to healthcare access. Moving forward, let's talk about Appalachia's people, the final P. So people are the region's most valuable resource. And I like to say that while Appalachia is poor financially, it's extremely rich in culture, collectivism, family values, and faith, making people the region's most valuable resource. And so I want to read to you one thing I learned during my studies in the Master's of Public Health is this life course perspective by brave men. And it really changed my mind and how you really look about somebody through their whole entire life course and what led them to that moment there in front of you, and you're learning about them. And so let me read you this little statement here that I wrote. So, in a region filled with environmental and social injustices, what would you do to protect your most valuable resource? People. Understanding this enables one to appreciate the unique culture of Appalachia, where folks function in close-knit networks to survive, where trauma is normalized, with people just trying to stay alive. And I really want to impart to you that many Appalachians have a survival mindset. It's not about thriving in the region, it's about surviving. And that relates to the persistent poverty of the region and the challenges folks face in this region. And so with having that survival mindset, Appalachians protect their own, and that is why people are the region's most valuable resource. Moreover, talking a little bit more about Appalachian culture, Appalachian's culture is collectivistic versus individualistic. And what I mean by that is that it's collectivistic, where folks work together in these close-knit social networks to survive in the region. I know families who share firewood for food and things of that nature, and where people really function together and to give you the shirt off your back to really help each other survive in this region. And moreover, the literature will talk about, and even my own experience about outsiders in Appalachia versus insiders. And again, this relates to people protecting their most valuable resource, each other. And what I mean by outsiders is somebody not from the Appalachian region or somebody who doesn't understand the customs and beliefs, and insiders are Appalachians themselves. And it has been found that Appalachians are close with each other and can be distrustful. They'll be respectful of people who are not from Appalachia. They'll be respectful, but they may not fully trust them. They really want to trust people they've known for a longer time in the region. And that's where those basis of trust comes from. Now, people who are outsiders can become insiders, but it is more about respect and about more of a long-term relationship. And so one provider who started working in the Appalachian region, who considered himself an outsider coming in and trying to become an insider, he said that Appalachian patients don't want to trust anyone who hasn't lived here for years. They are very protective, and if you're not one of them, they can chase you out of town. And so that is one quote worth remembering. So not many studies in the literature talk about Appalachians' perceptions related to their healthcare and health. And so that's what I really did my Master's of Public Health defense on. And it was relatively easy to write up because there are very few literature reports. And by easy, I mean it was easy because I only had to reference a few sources. And it was actually hard because I only had a few sources to reference. So that is really why it's important to emphasize Appalachian people in research and patient-centered care. And so this study by Marone and colleagues studied 438 Ohio Appalachians, and they found that Appalachians are less satisfied with the courtesy, convenience, quality, and information shared during their healthcare visits. In terms of courtesy, this related to providers not understanding Appalachians' customs and beliefs. In terms of convenience, as you've seen, it's hard to access healthcare in the Appalachian region, and so there's less satisfaction with the convenience from that. In terms of the quality and information shared during their visits, there's less satisfaction with that as well. And truly, to me, that relates to courtesy of care and not providing culturally informed care based on one's customs and beliefs. And so these results suggest that care in the Appalachian region is not being done in a patient-centered manner based on Appalachians' customs and beliefs. Moreover, I included this picture here to emphasize a kind of traditional Appalachian family, especially with the dog here in the front who's super cute. And I have a picture here going to grandma because really, I think in a lot of Appalachian families, and from my experience especially, there's really one key person in these social networks that really everybody trusts. Not everybody in these social networks may get along, but there's usually some keystone person that everybody really trusts and relies on. In my experiences, that is usually grandma, who is the glue that holds the family together. So after working in the hospital in this region for a while in college, I was blessed to do that. And growing up in this region, I would say if you really want to be a good family practitioner or a good doctor for any form or specialty, really educate grandma. If you provide good care to grandma and you provide grandma with the educational knowledge and tools to talk to her family members, these people will listen to grandma and respect grandma and trust grandma. So one thing they always say in Appalachia is to educate grandma and she'll educate the family. And so that's really one key point I wanted to put in here. Moreover, I put a picture here on grandma or grandpa as well with an arrow, because there is that stereotype that if an Appalachian farmer comes in, they'll say, yeah, I'm not in that much pain. And you look at their hand or something from being out farming, they might have like a finger or part of their hand cut off. It's like, it's fine. Just stitch me up, doc, send me back out. It's like, what in the world? Like, and I really think that relates to the survival mindset of the region. Again, people aren't thriving, they're trying to survive, and time is money and they got to get back out there. And so if it's just a hand with a few fingers missing, the other hand's good. Let's keep going. And so through my experiences, especially even in my own family and such, especially Appalachian farmers, if they say they're in a little bit of pain, you should be very concerned, because they're acknowledging they're in some pain at all. And so one thing that I like to do with patients when I worked out at the hospital, and I would talk to like the grandfathers or the husbands, I'd say, what would your wife want me to know about you? And usually this made people laugh and chuckle by asking them, hey, what would your wife want me to know about you? Because it's acknowledging that, yeah, they're going to cover up their pain, but my wife, wouldn't she be saying, no, you need to be in here, you need to get this taken care of. This is the most important thing you could be doing. And so that is why I wanted to share that. And so talking a little bit more about Appalachia's people, the American Psychiatric Association developed these best practice guidelines for working with Appalachian populations and patients. And I really want to take a few minutes here and watch this with you. So I'm going to go ahead and play this video now.
Hello, I'm Dr. Larry Merkel, an APA member and co-author of Mental Health Facts for Appalachian People. The evaluation of mental health disparities is often understood by one's race or ethnicity, but it can also be understood by one's geographical location. Appalachia is a region stretching from southern New York to northern Mississippi. 42% of the population is rural, compared with only 20% of the nation. Appalachia is one of the poorest regions in the country, with a poverty rate about 20% higher than the rest of the country. It's also less diverse racially and ethnically than the rest of the US, but there is increasing racial and ethnic diversity, with a rapidly growing Hispanic population and long-standing African American and Native American populations. The rate of educational attainment in Appalachia is much less than that of the US, and notably, there are social divisions between the wealthy, those who live in small towns, and the large number of rural people who often live in isolation. Appalachia has distinct cultural characteristics. For instance, it's collectivistic compared with the individualistic mainstream. Consequently, local culture revolves around family ties and kinship. Faith, mainly Protestant Christianity, is an integral part of many people's lives and greatly impacts their view of mental health. Honor and shame are dominant values, which translate into the importance of courtesy and expressions of respect. Thus, the culture is more relational than contractual, and being down to earth and authentic is greatly valued over being an expert with credentials. In the mid-19th century, Appalachia became an important national source of timber, iron, and coal. However, few Appalachians benefited from this economic shift, which disrupted the local culture and kinship structure. Many people were forced off their land and moved into mining and other camps. The people of Appalachia were stereotyped as ignorant, backwards, and violent, justifying exploitation. Modern examples of this stigmatization include shows like The Beverly Hillbillies and Deliverance. This tragic period in the history of Appalachia has continued through the present, contributing to the poverty, environmental degradation, and poor health of the region, exacerbated by the collapse of the timber, iron, and coal industries. Mental health problems in Appalachia are often driven by normal syndromes of distress, such as demoralization and grief. Experiences of trauma are normalized, and mental illness is highly stigmatized. Therefore, keeping problems within the family is critically important. And this is why Appalachian people first approach their family members and religious leaders about mental health problems. Outsiders, including most mental health providers, are respected but not trusted. Thus, non-intrusiveness is an expression of respect. Mental health providers need to honor the insider's view, using language, values, and assumptions that belong to the local culture. To learn more about Appalachian mental health and ways to provide appropriate mental health services to Appalachian communities, refer to the APA fact sheet, Mental Health Facts for Appalachian People. Thank you.
All right, thanks for watching that with me. And again, I hope you picked up on some of the key themes that I've been trying to impart from this talk. And I really think this, when I saw this video, I was like, wow, this is really a great video that really captured many of the ways that I've been studying the Appalachian region. And so I was happy to share that with you. And so moving on here, let's talk a little bit more about Appalachia's people. And so understanding the person and the context within their Appalachian culture and place is so critical. And really this relates again to the survival mindset of the region. And I want to explain that in a little bit more detail, talking about a distorted view of health. But before I do that, I want to again bring up the farmer's example. And this is me here on the right, and this is my grandpa here on the left. And as you can see here, he's a farmer. He was a construction worker, and you can see he grows these beautiful gardens. And garlic here that got first place out of the county fair. So that's the most objective way of analyzing if you're a good farmer, if you get first place at the county fair. And these babies here are first place. So they're beautiful garlic and they taste even better. And I really put him here and us here because he really emphasizes what I mean by that stereotypic Appalachian farmer. So I see my grandpa get injuries and things of that nature. And he'd be like, just stitch me up. I got to go back out. He'd tell you to drink some vinegar and it's going to be okay. And, it really imparts on that survival mindset where if things are just good enough to keep going, people will just keep going in this region. If it isn't too serious, people will just keep going. Or if they don't perceive it to be too serious, they will just keep going. And so that is what I mean by this distorted view of health. There are numerous reports in the literature that Appalachians may have a distorted view of health. And what do I mean by this? What I mean by this is that Appalachians will self-rate their health as excellent. And they may say, yeah, doc, my health is excellent. But they may have numerous objective markers of poor health, such as having diabetes, heart disease, COPD, increased smoking rates, alcohol use, obesity, things of those natures. Appalachians may say, I have an excellent health, but objectively, they have poor health markers. And that is what I mean by having a distorted view of health. And really, I think in this region, it relates to that survival mindset, where if things are just good enough to keep going, time is money, time is precious, just keep going. If you can keep going, just keep going. And I think that all relates to the distorted view of health that the literature talks about in terms of Appalachians' perceptions of their health. And so now after talking about the Appalachian people, let's talk about addressing the health of Appalachians. And so let's talk about telehealth, which presents both opportunities and challenges for providing care in the Appalachian region. And so telehealth is a great thing. As you know, Appalachians have difficulties accessing care, that they may have to drive several hours away to access care. And so telehealth can bridge that gap and come into patients' homes or meet them where they are. However, there are challenges with this. The Appalachian region has a lack of telehealth capabilities versus the larger nation. Specifically, Appalachian counties have 5% less ownership of electronic devices capable of internet connection or making phone calls. These things include tablets, phones, computers, the things we're using right now to listen and talk. There is an overall lack of those in the Appalachian region. Moreover, there are 6% less internet subscriptions and access in the region due to the geography of the region, that rural mountainous terrain. It's hard to build. Internet towers and things of that nature. Moreover, the poverty of the region restricts both the purchasing of electronic devices as well as internet subscriptions if they were actually available. Moreover, if we want to look at just the rural Appalachian counties, so these statistics down at the bottom are for Appalachian counties as a whole. If we stratify that out by rural Appalachian counties versus the nation, these numbers get even worse. So there's 11% less ownership of electronic devices and 13% less internet subscriptions and access. And so it is not uncommon to see kids after school or people in general parking outside the local McDonald's in their towns, if there's one available, to use the internet services there because, one, it's free and it's accessible. Moreover, libraries serve a central role in the Appalachian region for folks to go in and be able to accept and use computer devices and access internet. So Appalachian libraries play a central role in the community in providing access to devices as well as internet. And so telehealth, while it presents opportunities, it also presents challenges because the folks, especially those in rural Appalachian counties, are the folks that probably need the care the most, who are most restricted from accessing care, and they are further discriminated against by telehealth, and these opportunities are even lessened due to less ownership of electronic devices and less accessing of internet subscriptions. And so this all brings me to this key point, and this is really what I based my Master's of Public Health around. I got my Master's of Public Health in Health Behavior and Health Promotion with a specialization in health disparities, but I really like to say I got my Master's of Public Health in studying the Appalachian population. Every single project and every single class that we could, I studied the Appalachian population, and I was heavily involved in program planning, implementation, and evaluation courses. So I got to design a lot of programs to help to bring healthcare to the people. And by that, I mean that you want to bring healthcare to the Appalachian people. And so I'm going to really give you a synopsis of some of the programs that I helped design during my Master's of Public Health training. And so the first one here is probably my favorite, and that is Patch It Up. Your flu vaccine patch is here to help keep you healthy this flu season. Open this brochure to get started. And so you may or may not be familiar with this, but Appalachian people receive less flu vaccinations annually compared to the nation, which is not surprising at all. And one way to help overcome this is by increasing accessing of the flu vaccine. As I said numerous times, there's a lack of providers in clinics and pharmacies, so it's hard for folks to get to places where they can get their flu vaccine. What if we could actually just mail the flu vaccine to their house? That is what I mean by bringing healthcare to the people. And right now, this is not available, but you can see this person putting this patch on their skin. This patch has little needles with the flu vaccine on the tip of these needles. And basically, all you do is you place that on the skin, and the flu vaccine gets absorbed into the skin, and the person is vaccinated for the year. And while this is in phase trials, it's not yet available. My hope is that one day it can be used to provide mail-based delivery of healthcare to the Appalachian population. And they've done studies on that little patch already, and yes, it is safe and effective to mail them in the mail to people to use. Again, these are just little micro needles, so there is really no risk from that. And so all of this relates to our little envelope friend here, who we're going to see on the next couple of slides, and that is bringing healthcare to the people via mail-based delivery of healthcare. And so how else can we bring healthcare to the people? One of those programs is cervical cancer screening. And so, as you may know, the Appalachian region has higher rates of cervical cancer than the nation. Moreover, the cervical cancers are more invasive once they're found. And why are they more invasive in the Appalachian region? Due to the lack of screening. Appalachians receive significantly less cervical cancer screening compared to the nation. And so that results in invasive forms of cervical cancer. So how could we actually bring healthcare to the people? How could we bring cervical cancer screening to the person's home? And that relates to what is on the screen right here, and that is the Evelyn brush. The Evelyn brush is a device that can be sent to people. It has home-based directions here, and you can even see it being put in the mail here, where patients can self-screen for cervical cancer. They can take a scraping of their cells, and they send that back into their healthcare provider to be examined. And so this little Evelyn brush here is really the future of bringing healthcare to the people's homes in terms of cervical cancer screening. Moreover, there is this new thing being developed called the pocket colposcope, and this wouldn't be sent to people's homes. This is for more of the clinics. Again, there are less healthcare clinics in the Appalachian region, so providing them with, this is called a pocket colposcope, and if a patient has an abnormal cervical cancer screening result from the Evelyn brush, they may be say, let's drive to a clinic that's a little farther away, but we'll still be able to get care, and they can use the people at this clinic. This is a device that they can use to take images of the cervix, and this can be sent to specialists elsewhere to review them. And so this is just another way to further increase accessing of care in the region. And these pocket colposcopes are relatively affordable, and these can be provided to clinics to use to help in aiding in cervical cancer screening and working up patients. And so again, this is all based on the mail-based delivery of care, especially that Evelyn brush being sent to patients' home. And so let's bring healthcare to the people in the Appalachian region. One last example is, how would we bring colorectal cancer screening to the Appalachian people in their homes? While colonoscopy is the gold standard for colorectal cancer screening, this would be hard to bring into a patient's home. So what can we actually bring into a patient's home? A FIT test. And while the colonoscopy is the gold standard, the FIT test is the fecal immunochemical test, and it's performed every year. And basically patients just dab a little bit of stool here, and it tests for blood in the stool. And this does not require any bowel preparations, anesthesia, or transportation to and from the screening examination. And right from the manufacturer itself, says the test is performed at home. And so these FIT tests play a critical role, I believe, in getting people to move along that spectrum of change in terms of taking action in the Appalachian region. So I know people will say, colonoscopy is the gold standard. We need to advocate for just getting people with colonoscopies in. And I totally agree with that. But some folks are stubborn, especially in the Appalachian region, and they kind of need that that movement forward. So I think if you send them this test at home and they were able to just, oh, this is easy. I can wipe a little bit of a sample on there and, oh my gosh, I have blood in my stool. You know what? I probably should drive a little bit farther to be seen. I probably should go schedule that colonoscopy. I think things like this will move people along that spectrum of change and help them move into from that contemplation or pre-contemplation stage to that action phase of actually going and getting their colorectal cancer screening with a colonoscopy. And so again, this all relates to mailing these kits to people and providing mail-based delivery of healthcare. Bring healthcare to the people in Appalachia. That is really my key takeaway from my Master's of Public Health Studies. And so, moreover, I think it's important to create public health infrastructure in the Appalachian region. And one way that I was blessed to do this during my Master's of Public Health training is by getting a disc golf course put in at a local park. So I was very blessed to help my mom and my aunts and my family. We were able to design this disc golf course here at a local park. This is only about 3 minutes from my home where I'm giving this speech to you today. It's called Chasing the Chains Dunning Motor Sales Disc Golf Course. So I'm very blessed that the Cambridge City Park, as well as John Dunning, helped put this course in and funded it along with their other partners. And if you don't know what disc golf is, use our little logo up here at the top. Disc golf is where you throw a Frisbee into a basket. And so it's a really good thing for the Appalachian region because it is affordable and free to play. This course is completely free to play. All disc golf courses are free to play, and discs here only cost about $5 to $10. And you keep that disc for as long as you have it until you throw it in the water here, I guess. But it's a cheap way for people to get out. And in a region that is really poor, having cheap, affordable ways for people to get out and get healthy is so important. And so that is why it prompted me and my family to help design this disc golf course here. And so just sharing a couple pictures, here I am with my family. This is my little cousin Emmy and Kayla, my mom Mary here in the back, and my Aunt Rose. We're playing disc golf here, and you just throw the disc into the basket. Here's me at Muskingum University. I got a hole-in-one here, an ace, and I'm being silly and giving my disc a kiss. And here's my little cousin rolling her eyes at me because I'm being silly. And so disc golf is such a great way to get out and get healthy with your family, and it is a cheap and affordable way. And really, I think getting this course put in at the Cambridge City Park, it really sparked within me that you just need to try. There's a village of support in the Appalachian region. I've known this throughout my life. And just by asking folks, hey, can you help with this? Can we do this? Just by asking, that is being an advocate for the health of people in Appalachia. And so talking just a couple more things here. So we also need to advocate for policies, equitable policies in the Appalachian region. And so I'm going to share with you this visual abstract. And I just gave this presentation yesterday to finish out my Master's of Public Health career about a policy that I think would be worth advocating for in the Appalachian region. And so really this was based on opioid-related elder abuse. And as you may know, the opioid epidemic is especially troublesome in the Appalachian region. And so what is opioid-related elder abuse? And you may not have heard of this. So let me explain what it is. Opioid-related elder abuse occurs when older adults age 65 plus are exploited for their prescription opioids and or financial capital, usually by caregivers or relatives who then consume or profit off of these opioids and resources. And right now, what is so troubling is that there are a lack of policies mandating opioid-related elder abuse by agencies that deal with it. And so adult protective services in the Appalachian region are the services that mainly deal with this, but there are no official policies that actually mandate that they report opioid-related elder abuse. Currently, only drug-related elder abuse is documented. That is macro-level data reporting. Opioid-related elder abuse is micro-level reporting because it's specifying the exact substance involved. And with the opioid epidemic being so prominent in the Appalachian region, it is important to specify what drug was involved in elder abuse so certain things can be put in place to mitigate that. And so there is just a deplete in the literature. Really, this paper down here at the bottom by Roberto is the only one in the literature that actually talks about opioid-related elder abuse, and it was published in 2021. And so this is called the hidden pathway of the opioid epidemic because it's now only being realized due to the lack of policies mandating that it is reported. And so from the few studies that exist, up to 75% of elder abuse cases in Appalachia occur in relation to opioids, and there has been a 35% increase in opioid-related elder abuse cases since 2017. So we really need to advocate for equitable policies in the Appalachian region. And so how can we do this? We really need to give voice to the people. And so pictured here on the left is a good representation of how the literature looks with objective data about the 3 Ps. These are data that don't come from the people themselves. This is talking about health disparities and the poverty rates and all these different things. These are like secondary data analyses. These don't really focus Appalachians in the center of these documents. And the literature is just replete in them. But the literature is just deplete in subjective data from Appalachians themselves. There's just very few reports that actually look at Appalachians' perception perceptions related to their healthcare and health. And so that is why we really need to prioritize Appalachians at the center of literature going forward and really amplify their voices. And so while I could present my research to you, unfortunately, I had a poor survey response rate that really sought to explore Appalachians' perceptions related to their quality of medical care, as well as sociocultural factors affecting their medical care, such as knowing their provider outside of the healthcare community. Does that increase or decrease your likelihood of accessing care? Didn't have a good survey response rate for that, but I want to focus on the intersectionality framework that I use to guide those studies. And that really relates to the intersectionality of Appalachia's poverty, place, and people. And so I modified this diagram to use in my studies because this was the first diagram that really talked about the 3 Ps of Appalachia, about environment, the place, and then people in terms of demographic and health behavior. And this diagram really emphasizes that these 3 Ps intersect with one another to influence the health status and satisfaction of people in the Appalachian region. And really, again, the key point is that we need to center Appalachian people at the center of all discussions and really center them and get their perspectives related to their health and their healthcare, because that is lacking in the literature. And here's a picture of Dr. Osler, because he says, listen to your patient. He's telling you the diagnosis. Listen to Appalachian people. They're telling you what they need in the region. And they're telling you what is good and bad in the region. Appalachian people are very blunt. I love bluntly honest people because they tell you what they're feeling. It's time to emphasize them in patient-centered care, as well as community-based participatory research, and really centering Appalachian people at the center of their health and their health care. And so just a couple more slides here about the support that I've received from the Foundation for Appalachian Ohio. Here's Tracy with me here, and this is a talk that I just gave recently with them at one of the banquets. And so again, I call the Foundation for Appalachian Ohio dream makers. They really made my dream of pursuing my medical degree, my bachelor's of science, my master's of public health. They've made these things possible for me. Coming from a region, I grew up in a single parent home, and I really couldn't conceive that I could go and explore advanced education, especially with my family's financial status. Things such as through the Foundation for Appalachian Ohio made my dreams possible, and that's why I call them my dream makers. So I really advocate for you to give them a call or send them an email to see how you can get involved. They even partner with Joey Burrow, and if that isn't an indication that you need to get involved with the foundation, I don't know what is. They're doing great things. They're providing scholarships to people to incentivize people to come back and practice and develop their careers in the Appalachian region. They're increasing internet access across the region. They are doing so many great things and making dreams possible for other Johnnies in the world to really seek out and explore their dreams and be a difference maker in their community. And so I want to end by talking about how we can move the mountains of health disparities in the Appalachian region. And that all begins with believing in yourself and that you are one small stone. And so I want you to imagine tossing one small stone into a body of still water. What would that do? That would produce rings that are concentric and reach out and touch all aspects of the store. And so why I am only one stone and you are only one stone, we are only one person, we only think we can do so much. You would be amazed if you just try and you keep advocating and you keep pressing forward, how big of an impact you can make. Just imagine that little small stone. When it entered the water, it probably didn't think that it could make these big rings that reach out and touch all aspects of the shore, but it did. It takes believing that moving and using small stones can create widespread changes that can help people and help the larger Appalachian region and community. And so that is why I want to impart on you that the key to moving mountains of health disparity in the Appalachian region is to begin by moving one small stone at a time. If you think about mountains, mountains are simply composites of small stones, right? Imagine if each and every one of us removes one small stone and each and every one of us takes away that small stone. We could literally move a mountain together. And that is why the key to moving the mountains of health disparities is to begin by moving one small stone at a time. And how can you help move one small stone at a time? Well, you're doing it right now by tuning into this discussion, as well as continuing the discussion. Please follow me on Twitter at JohnCarlBarba2. I have a short thread about the 3 Ps of Appalachia on there. Please retweet that, share that. I did that as part of This is Public Health Ambassador that I was for the College of Public Health. Please go on there, share that, get people motivated about the Appalachian region and making changes. So with that, I always like to say there is a great, big, beautiful today and tomorrow in Appalachia. And I thank you for your time with this talk. And I'm very blessed and honored to get to give it to you today. And so if you would like some references, I have them in a Google Doc if you'd like them. And please take a picture of this scan right here and you can leave me some feedback. And with that, I will stop the presentation and I welcome any and all questions. So thank you all.
Great job, Johnny. You're not a shy speaker.
Thanks, Tracy.
You do have some questions. What structural or policy changes would you want to advocate for to improve Medicaid and improve quality of medical care provided to the people of Appalachia?
Yeah, I think that is a great question. So you said basically what policies would I advocate for with Medicaid? I think it's just, I think doctors, I believe, want to do the right thing in providing care, but like like I said, they can only accept a fixed amount of patients with Medicaid due to that fixed payment structure. So it's really a larger issue. And I think, I always say the insurances make doctors look bad. Doctors want to provide care and do good things. I think there needs to be incentives for taking on Medicaid patients. I think providing and supplementing that funding from insurances would be a good way to do that. There has to be some way to increase the profits off of that, not profits, but sustainability profits, I should say, not making money off of people, but some way to make it more sustainable for doctors' offices and physicians and providers to accept more Medicaid patients. Because I've even heard reports of people going bankrupt because they're like, I'm going to accept every Medicaid patient, and they literally cannot sustain their practices. What was the latter part of that question, Tracy? The policies?
Improve quality of medical care provided to the people of Appalachia.
Yes, I really think that should be dictated by Appalachian people themselves. I have my own personal views on that, but like I said, my Master's of Public Health research was really about centering people on their quality of medical care and perceptions related to that. We really need to focus on that people aspect of the intersectionality model. That study I showed by Marone and colleagues is one of the very few in the entire literature database that actually centered Appalachian people at the center of saying, what do you think about the quality of your medical care? What do you think about the perceptions related to that? I really think we need to center Appalachians and focus groups and things of that nature to really ask them, how would we improve the quality of medical care for your region? And I think providing cultural competent care, I think that is something we all can do. And engaging in, I like this term, it's cultural competentability. Yes, that's a word. I couldn't believe it the first time I heard it. Competentability means becoming more competent in somebody's culture and becoming more humble, and meaning just having an open mind and wanting to explore those things. So I really think centering Appalachians and trying to provide culturally informed care is a really important thing for that.
And another question, are vaccination patches something you see rolling out for other childhood and adult vaccinations?
I think it'd be awesome. I think it'd be great. I need to do more digging in the literature. I know right now the flu vaccine is kind of like a famous one that's being developed right now, but I think something along those lines would be an excellent way to help overcome those barriers to care. Anything where you can bring healthcare to the people, I think would be great. And developing other forms and other pathogens in those vaccines, I think would be an excellent way. Could you imagine how good that would have been during the COVID-19 pandemic if we could have sent out patches to people's homes? That would even reduce people being in contact with others. That would have been such a strong thing. So I really think in the future, in the next 10, 20 years, I think we're going to see a lot more patch vaccines.
Those are the questions that you had come in, Johnny, and you had lots of great comments in the chat.
Oh, thanks, Tracy. I think I saw Dr. Pereira's hand up too. I may have just saw that. I think maybe not.
I'll allow her to talk. Sorry.
Sorry. Can you hear me now, Johnny?
Yes, I can hear you, Dr. Pereira. How are you?
Okay. Great talk, Johnny. Really enjoyed it. But my question has to do with, have you ever looked into how Scandinavian countries deliver their healthcare?
That is an excellent question, Dr. Pereira. And so during my first year of the Master's of Public Health, we explored different healthcare delivery systems. I can't say I know exactly the Scandinavian one, but I like where you're going with that and using other models of healthcare delivery to kind of base some policies and things like that. I think that'd be great. But no, I have not specifically. Is there any certain things that I could look for with that?
No, I'm not very sure about specifics either, but I mean, we know that they do a great job in delivering healthcare to everybody. So that's really what I was wanting to get at. You know, the doctor that I go to one time had a notice on her window that said, no Medicaid, no Medicare, no Obamacare of any kind. And that just like, I was afraid to go to her anymore, but she's a great doctor. So I continue to go to her, but you know, I don't know, with the way the medical system is set up in the US, I'm not sure what else can be done. That's why I was wondering about looking at other models of Medicare, of medical services delivery.
Oh, no, I think those are excellent points, Dr. Pereira. And I think, you going to that doctor and saying, even though she has these signs up, she's an excellent doctor. I think that really speaks loudly to the insurance problems and where it really makes doctors look like bad people when really her practice may be just trying to survive financially and it can't because of those certain payment structures. And so I think that really speaks volumes to that point. So thank you for sharing that, Dr. Pereira.
Yeah, no problem.
Another question came in, Johnny, from, it says, hey, Johnny, great presentation. You should be proud of your work. And as a fellow Appalachian, I appreciate the work you are doing. My question is in regards to your perceptions, opinions on rural Appalachian food systems. I run a nonprofit in my rural Ohio Appalachian hometown, and working with the county's food systems has been one of the most promising fields we have seen for fundamentally addressing community-wide health.
Yeah, I think that is excellent. Well, I didn't talk about it in this presentation, especially. There are food deserts, especially in the Appalachian region, where there's just nothing. There's a lot of folks out in rural regions that are just isolated. And I think having those food systems and secure places of food is such an important thing. And I really, I'll be transparent with you. Growing up, I went to food banks and things of those natures. And while those are excellent, excellent things, sometimes the food can be outdated or, they give so much produce to people. And it's like, oh my gosh, how are you going to use this in a couple of days, all these vegetables? And so, I think it's good, like people giving produce, things like that. If you don't use it within a couple of days, it may be towards the end of its lifespan and it may start to rot. It's like, oh my gosh, even though they get this food, I think it'd be interesting to study how sustainable those food options are and kind of pouring it on. It's almost like you need a more sustainable way to get food where it's not like all dumped on somebody for once. It's like, here's your food for the week. It's like, how am I going to keep, that celery, those cabbage, how am I going to keep that all good for a week and things of that nature? So I think that having sustainable places have food like that and working with that is such an amazing thing. And fellow Appalachians, I thank you for your work and in trying to provide food systems and really overcoming the health challenges of the region. Thank you for your work. And that is an excellent, excellent point.
I think Allison's jumping in.
Just wanted to thank you both and for your participation and amazing insights today. Johnny, that was such an incredible talk. I feel like I learned so much, and it's clear that Ms. Mann and the foundation thinks highly of you and that you guys are all doing incredible work. So I just wanted to say thank you. Congratulations on all of the accomplishments and things you've done in this field. And I'm so excited to see like what your career is gonna, like where it's gonna take you. Like, I'm really inspired by you. So I guess if there's no other questions, we can wrap up this discussion, but you have so many congratulatory comments in the chat. And if it's okay, like people can probably reach out to you after if they have follow-up questions, right?
Absolutely. Absolutely. And I should say, I should have listed this, but my email is John, just my name, John, JOHN, .Barba, BARBA at OSUMC.edu. So that's OSUMC Medical Center.edu. So please reach out to me or follow me on social media or find me on Facebook, shoot me. And if you have my email, shoot me a text or anything. I'm always happy to talk and continue this discussion. So thank you, Allison. And I'm inspired by you as well. And I'm inspired by the whole having the medical student grant rounds. When I started medical school, this didn't exist. And this program is so powerful. And I thank you all for your efforts you put into making this possible. So thank you. And you inspire me as well.
Saying that. And thank you so much, everyone. Have a great rest of your day. Thank you all. Bye.